One way of reducing obesity rates is subsidizing farmers markets in order to support the growth of healthy fruits and vegetables. Currently, agricultural markets are skewed toward the production of ingredients of processed, energy-dense foods. The two of the most heavily subsidized foods are corn, soybeans, which supports the consumption of high fructose corn syrup, soybean oil, and grain-fed cattle. This diet of grains in a highly processed form leads to obesity and chronic diseases. Corn especially has been a staple in highly processed foods, from sweet breakfast cereals to soft drinks. Let's take the local grocery store, Giant, as an example of the disproportionate pricing. It's right down the street of Johns Hopkins. For $1 at Giant, you can purchase 400 calories of Fritos corn chips, or you can purchase 70 calories of baby carrots. Unfortunately, because of this proportionality, Baltimoreans pick chips more often than they pick for carrots. Consequently, we want to assist those farmers that grow unsubsidized fruits and vegetables and give a reason for monoculture commodity farmers to grow some fruits and vegetables instead. As of now, healthy fruits and vegetables are only more expensive because they do not receive the kind of crop insurance and subsidies that commodity crops do. It is true that pouring money into corn and soil is more profitable, but then again, it perpetuates obesity. Thus, we propose to transfer subsidies for large commodities such as corn and soy to fruits and vegetables. These healthy options will become cheaper and more accessible in Baltimore, which would consequently reduce obesity rates.
One of the many ways we can try to tackle obesity is by treating it as any other disease and by using healthcare as an invaluable tool that can help us in doing so. Unfortunately, you have many primary care physicians that might only tell you that you're obese, but will actually do nothing about it to help you. And despite studies showing that basic counseling about healthy behaviors takes less than 5 minutes, physicians often do not incorporate it into the visit. As a result, for clinically obese patients, 70% do not receive a diagnosis of obesity and 63% do not receive counseling from their physician. Primary healthcare physicians are responsible for treating obesity as any other disease and should take any required steps to help cure and prevent further complications such as stroke, diabetes, and many other types of cancer that may arise due to obesity. Therefore, proposing a bill that pushes primary care physicians into taking the appropriate measures to help treat obese patients would not only cure one disease, but would also be preventing many others. The U.S. spends more than any other nation in healthcare trying to tackle obesity, but yet have one of the highest figures of obesity in the world. One of the main reasons behind this is that we don't have our first line of defense, primary physicians, combating this issue effectively. As Mayor of Baltimore, you certainly recognize the threat that obesity poses to a healthy community. By having primary care physicians acknowledge obesity as a disease and spending time with their patients, addressing the issue when needed, we can go a long way in ensuring we lead healthier lives as a community.
There are 4 major factors hurting children's health right now that are published by the Division of Epidemiology and Community Health from the University of Minnesota. And so basically what we need to do is to improve the school environment. One of the ways that we can do this is by limiting the number of competitive food chains that can sell within schools, especially secondary schools. It's shown that if students have the availability of snacks and drinks with high intake of calories and different kinds of soft drinks with high total fat and saturated fat, then they won't be taking in fruits and vegetables as much. We also need to improve physical activity within the school curriculum, but that's more of education. We also need to have federally funded school meal programs, and that's through the National School Lunch and Breakfast programs. And then the third point isn't really as important, so we'll just skip it. There's only so much that the community can do to limit the obesity crisis. When targeting children, it's important to establish healthy routines at home, so improving the school environment isn't the only thing that we need to do. We have to limit the amount of sedentary behaviors that children participate in, such as watching television or playing video games. Parents should also be providing positive and negative reinforcement when certain physical activity goals have been reached.
Providing ways for students to learn about healthy foods and lifestyles is crucial to the prevention of obesity in the future. For elementary school students, we can implement a garden-based nutrition education, which will motivate them to eat healthier and become more physically active. By including children in the process of planting their own seeds, watching them grow, preparing the grown food, and eventually eating them can give these students a new perspective on eating healthy. This garden can spark enthusiasm for eating fresh and potentially locally grown fruits and vegetables. Not only that, gardening provides a form of exercise for these children, which allows them to learn and move around at the same time. On the other hand, for middle and high school students, physical education should be emphasized. Study results have shown that participating in physical activity during the school day showed a positive relationship to the students' academic performance. Multiple studies have confirmed that health benefits are associated with physical activity, including cardiovascular and muscular fitness, bone health, psychosocial outcome, and cognitive brain health. Therefore, by implementing the garden building activity into schools and stressing the importance of having the older students participating in at least 225 minutes of exercise per week will cultivate healthier bodies and minds for the future.